Hello, amazing listeners. Welcome to another episode of the Boob Business Podcast, the unscripted show where we unveil, demystify some of the confusing parts of birth, breastfeeding, and infant care during the first year of life while having a little fun. I'm your host, Naomi Catron, registered nurse and board certified lactation consultant. Our mission here is simple: to foster collaboration in maternal child health and empower both families and businesses alike. We're all about creating a community where everyone feels supported and informed. In each episode, we dive deep into engaging discussions that span the entire spectrum of birth through the first year. From newborn feeding, because let's face it, it's something we all have got questions about, to tackling issues like tongue ties, the mysteries of pacifiers, mental health, body work, and just so much more. So whether you're a new parent navigating the incredible journey of early parenthood or a seasoned professional in the birth business, this podcast is your go-to source for laughter, knowledge, and some great insights. So we're here to make learning about boob business not just informative, but enjoyable. So join us for conversations that not only spark your curiosity, but also bring a smile to your face. So remember, every episode is a chance to connect, learn, and share. So hit the subscribe button and let's embark on this exciting journey together. Hey there, Jessica. Thank you so much for being on our show. How are you doing?
Good. Thank you for having me.
It is my pleasure. I saw the reason Jessica's on the show. She and I knew each other from our nursing days together. We worked together, and I saw her make a social post about a new guidelines that AWHONN has put out to help us, postpartum women, not us, but postpartum women in our community, know some of these post-birth warning signs. And so I first wanted to ask if you might be able to share a little bit about your background and then maybe share what is AWHONN? I don't know if everyone knows what AWHONN even stands for.
Of course. So my name is Jessica Irrobali. You all can call me Jess when you see me. So a little bit about myself. I started in nursing a little bit late. The reason I started in nursing was because when I was 21 or 23 years old, I was on Medicaid. I gave birth at one of our hospitals, and I was treated pretty unfairly. And that trauma actually made me go into labor and delivery nursing. I felt like nobody should go through that when they're in their most vulnerable stage of life, especially when it's supposed to be a happy time. And then later on, I developed post-birth or postpartum depression. So I went ahead and went into nursing, went into labor and delivery, became a perinatal educator, did labor and delivery, I want to say for 11 years. Well, I feel like I'm still doing labor and delivery. And then once I did my perinatal educator role, I became the maternal designation program manager, which is a quality role where you can put patient initiatives, maternal safety patient initiatives into the hospital. And I went ahead and I was one of the leads to get my current facility a level 4 designation in Texas. Texas requires level 4 designation. Once I finished that, I decided go into AWHONN with my critical care and quality background and apply. And now I have a role there as a director of collaborative programs. And in my role, I am the nurse lead. I have direct oversight of several programs, that being one of them, post-birth warning signs.
So tell us what AWHONN is.
Okay. So AWHONN stands for the Association of Women's Health Obstetric and Neonatal Nurses. And our mission is to, I forgot what our mission is. Our mission is to provide support to those that provide care to patients and their family through nursing, education, research, and advocacy. So a lot of what AWHONN does is we represent 350,000 perinatal nurses in the nation. We provide their education. We do things like we go to AWHONN on the Hill annually to discuss really important bills like Maternal Mortality Death Act, the Workforce Bill, Veterans Act. Then we do a lot of research, and then we have a lot of education to support anybody in the women's health, obstetric, and neonatal space.
Yeah. I'm going to tell you, I didn't know your story about how you came into perinatal health. And I think that's really fascinating. A lot of people a lot of brown people like us come into this space from something like that, which is fascinating because I have a similar story. And it's funny that I turned out to be a labor and delivery nurse because that's my labor and delivery was a total mess. And then lactation was a total mess for me too. And not having people that look like me at the bedside was normal to me, but made it a little bit challenging, to say the least. So I didn't know that part about your story. It's just interesting that you are able to make such an impact, because AWHONN, I don't know if you remember this, but I actually met you for the first time before I even started working with you at the hospital at an AWHONN conference. I was there with my husband. Remember that? I think Christian worked for a company. We were at an AWHONN conference, and I'm such a nerd that I love to do all those things. So now I'm really involved with lactation conferences. But the AWHONN organization, I will tell you, I think is stellar when it comes to the education and resources they provide to nurses, like labor nurses and NICU nurses. Now, whether hospitals follow their guidelines, that's their choice, but they put very, very important research out there and very, very important recommendations for safety out there, and very, very important training. So they are for sure the gold star when it comes to, I would say, labor and delivery nursing and NICU nursing, and how we should be doing things in a safe fashion. So my ears perked up, or my eyes, perked up, whatever you want to say, when I saw your post about this new post-birth warning signs. Now, for people who are listening and cannot see, I have a copy of it right here, but you're not going to really be able to read it. So I'm going to put links in the show notes, because it is translated in lots of languages. And you have some videos that you're working on getting translated, the captions, if I'm not mistaken, or the audio in multiple languages. I feel like this is going to be really, really important. These kinds of things are very important because our country does have a very, very high maternal mortality rate, and a lot of these complications are happening postpartum. So maybe can you tell me why postpartum health awareness is so crucial, and what inspired AWHONN to create this initiative on post-birth warning signs? I think you had mentioned some research.
Yeah, sure. Perfect. So yes, the current disparities and the current maternal mortality in the United States is high. It's 23 per 100,000 births. And so that people can understand the comparison, in the UK, it's 13 per 100,000 births. So we're double as far as maternal mortality in our nation, and higher in Texas. So because AWHONN has a dedication to reduce maternal mortality, and because we see 53% of these deaths occurring once the patient leaves the hospital, they decided to do some research on discharge instructions. In 2016, they gathered a team of experts, and they talked to nurses that provided discharge instructions across the nation. And what they found is that most nurses focus on breastfeeding, wound care, and issues with the neonate and like I said, lactation, and never really focus on the post-birth warning signs, on when to come back, when to get help, what to recognize, and when to be alert. So what AWHONN did is they went ahead and created an education course to show nurses how to provide standard discharge instructions to everyone, not just those people that have had an abnormal labor and delivery experience or a postpartum experience, but everyone, because this can happen to anyone, even if you've had a normal labor and delivery experience.
Okay, that's really helpful. And those numbers of 23, our 23 compared to the UK of 13, in other countries, I imagine it's even lower. Is it true to say that the number of Black women who have complications is even higher than 23?
Yes. So the disparity as far as Black women, it's 50%. It's higher. So Latinas is around 11 or 11 or 13%. I think white's like 9, and then it's 50%. Black women are more likely to die from a 3 times more likely to die from a maternal death than our white and Latina counterparts. And so are Asian American women as well, like Pacific Islander.
Are higher risk.
At our higher risk.
Yeah. Mm-hmm. Can you walk us through the 9 key, it's 9 key, yeah, that's what I got, 9 key postpartum warning signs that every parent should be aware of? And I imagine the parent, meaning the mom and the partner, kind of a team effort, and even the caretaker who's taking care of the mom when she goes home. Would you mind kind of walking through those 9 warning signs?
Not at all. Not at all. So it should be for everybody that is in the support system, because as you know, if you've ever had someone who's had a cold or allergies, we try to normalize our signs and symptoms of any kind of illness that we have. So it's important to engage all the support people so they can tell you, no, this is really a symptom. You need to go get help.
Okay.
So first of all, post-birth is an acronym, and the way the handout is designed, it's designed when you should call 911 and then when you should call your provider. So the first 4 warning signs starts with post. P, pain in chest, and O, obstructed breathing or shortness of breath. And that can relate to any kind of clot or any kind of cardiac symptom that you may be experiencing. Now remember that this can happen anytime within a year after you've given birth. Then the next one is S for seizures. And so that's usually an indication of of preeclampsia or eclampsia. It's part of hypertension postpartum. And then T is for thoughts of hurting yourself or someone else. And that's more related to postpartum depression or psychosis. There are signs and symptoms that you may not see that are not like apparent, and they're like they're slowly like you feel like they're innocuous, but then they are like signs and symptoms of postpartum depression. And thoughts of hurting yourself is obviously a reason to call 911. Then you have birth. And you want to call your provider. And it's really important that you know that all you need is one sign. One of the things that we saw in some of our research when we talked to 41 women who received this is they were waiting for either a sign to get worse or for them to get another sign, which is not a good job. You want to call your provider right away, and you want to investigate. So the second part is birth. So B for bleeding, soaking through one pad, an hour, blood clots or that are the size of an egg or larger, then an incision that's not healing. So that can be a cesarean section, that can be a laceration or a vaginal tear or a episiotomy. That can be any kind of incision that's not healing. Then red or swollen leg that's painful or warm to the touch, that can be a clot that's either caught in your calf or your leg, and so that's R for red. And then T for temperature of 100.4 or higher or 96.8 or lower. So that is an indication if you have like bad smelling vaginal blood, discharge, it may mean you may have an infection. And right now, sepsis is one of the highest causes of maternal mortality, and is actually one of the causes of maternal morbidity in Texas. So you don't have to have a fever to know that you have an infection. You can actually be cold and still feel lethargic, still feel fatigued. You still need to call your provider and investigate and make sure that you don't have something or you may have retained products, and that can cause you to become septic or sick. So that's T for temperature. And then last, it's headache. It's headache that doesn't get better with any kind of pain medication, or a bad headache with or without vision changes, or vision changes by themselves. So H for headache. So call your provider. It might mean that you have a high blood pressure of greater than 160 or greater than 110 diastolic and greater than 165 systolic. And
systolic is the top number.
Yes.
Diastolic is the bottom number, because our audience may not be nurses. So I do want to circle back to a couple of things that you said to help maybe make it easier to understand. Tell people what sepsis is. I don't think people realize how big of a deal sepsis is and how quickly a person can go into sepsis.
So sepsis is when you have an infection that is affecting like all different organs in your body and can be in your blood, right? It's an infection that has gone so further out that you actually need antibiotics, IV, septic shock is something, and you have to figure out what is causing the infection. And so this requires immediate doctor intervention or hospital intervention. And it's sometimes, you don't know that you're becoming septic, but because our patients are so healthy, people tend to forget that they can get sepsis easily, especially in the postpartum period or in pregnancy, and they actually can get it really quickly. And so it's really important to go in and get checked.
That's super important. Yes, because different patient population, but we did have an experience with sepsis in my family recently, and it's because many times women are like, it's fine. I'm going to get some good rest tonight, tomorrow I'll feel fine, or it's just allergies, or they wish it away. And it's not until this person was like, I can't walk, I need to go to the hospital. And by that time, we are way past initial phases of sepsis. Now we are, at that point, there was kidney complications and all that. So I've also seen patients in the hospital get sepsis from untreated mastitis. So that's a reason. And when I say that, I'm not trying to scare anyone like, oh my gosh, I have a lump in my breast and I'm nursing and it's a little tender, I need to go to the hospital right now, I might have sepsis. No. But hey, do you have a fever? Are you having chills? Like, your provider is giving you instructions. Please, let's take them seriously and not wait until you cannot walk somewhere and then decide to go to the hospital, because then sepsis then becomes a multi-organ. It could lead to multi-organ failure. But if we catch it early, we are going to want to take care of that, because we want you to get well and go back home. And otherwise it can be lethal if not treated, So it's not something that essential oils or changing your diet is going to help rectify. So thank you for pointing that out. Tell me, some of those symptoms like headaches and swelling might seem minor, but how can parents and healthcare providers distinguish them between normal postpartum changes and serious warning signs? I kind of just touched on that, but I didn't know if you wanted to add anything to that, because I think we wish it away.
Right. So like any vision changes whatsoever with or without a headache. If you've had Tylenol and your headache doesn't go away, obviously. If you have right upper quadrant pain or right upper belly pain, that can be an indication that the preeclampsia or something else called HELP is affecting your liver. So any kind of those kind of symptoms, maybe spots in your vision, you want to go ahead and get help right away. And then if you have a blood pressure cuff at home, I usually say that if you're anywhere systolic above 30 millimeters of mercury, so above your baseline that you were in pregnancy, then you want to go ahead and talk to your physician. I don't only like going through the number. I like actually looking at patients' baselines and seeing if they've gone above 30 millimeters of mercury above that. Yeah.
So do patients know what their average is, would you say, when they go home?
Some of them don't, and some of them do. So if you have a systolic of 140, then you want to be, that's a clue that something's wrong.
So if the top number is 140, what if it's 139?
And I would call. Yeah, I would wait 5 minutes, 15 minutes, take it again, and then call. Because what's the worst that can happen? The worst that can happen is that they're like, come back or take it 15 minutes again and give us a call back. That's the worst that can happen when you call. But what's the worst that can happen if you don't? You can have a seizure. You can lose your life. And like you said, I don't want to scare anyone, but I just don't want people to not know what to be looking for to recognize and get help.
Yeah, absolutely.
And if you give me a chance, I wanted to talk about really quick, the thoughts of hurting yourself or someone else. Right now, the data is showing us that maternal mental health is really high up there as far as morbidity and mortality. So I wanted everyone to know that the federal government has a line to contact if you have issues or if you want to talk to somebody, and they usually give you a warm handoff. They speak 20 different languages. It's called 1833 TLC Mama, 1833 TLC Mama, or you can text 988.
988. Good. Look at you having all these resources. I love that. Our next podcast, I don't know which one's going to come first. I don't know if I'm going to air this one before this other topic, but it's all about this cool new resource for people who would like to get perinatal mental health support and use, like they want to get it covered by their insurance, because a lot of those providers, they're specialty providers, so they're not always taking insurance. But there's this really cool company that now is taking insurance, and they do it virtually. And they have really great representation, and they're doing it from the comfort of your home virtually, so that you can have your baby with you and not have to schlep all your things around. Because I feel like getting good mental health support that's specific to perinatal, like if you've had a loss, or even if you're just struggling with having a baby and like the life change, being able to have someone at your fingertips is really nice. And having it paid for by your insurance is sometimes what makes it accessible or not accessible for people. But I love the resource that you gave out, because that's for everyone. So I love that. I know that we've talked a lot about a lot of these symptoms, not for nothing. are related to preeclampsia. And one thing I did want to share is, and please correct me, because you've done a lot of high acuity cases in the hospital you used to work at together. And a question I get often is, like, people think that there's a test for preeclampsia, that it's a binary diagnosis, like a pregnancy test. Do I have preeclampsia or don't I have preeclampsia? And so in May of 2022, I did a podcast episode with Dr. Crystal Berry Roberts. It's episode 13. It's called the episode that will save a mother's life. And it's all about preeclampsia. And she does an amazing job of really calling physicians higher to really listen to their patients. But what I do want to emphasize here is preeclampsia is not a binary diagnosis. It's not something like you pee on a stick and it tells you have preeclampsia or not, or like, hey, do I have flu, positive or negative? You take a swab and you do, or strep. That's not how preeclampsia works. And preeclampsia is almost like this hidden little, I don't know, little monster underneath the current, and it peeks its little head out here and there and then goes back under the water, and you don't know if it's fully going to emerge and cause a full-blown preeclamptic physiology or pathology. And so that's why these small symptoms, they're like little puzzle pieces. And if I'm not mistaken, you need two if you meet two criteria, then they can diagnose you with preeclampsia, which changes. And I haven't been in the field a lot, but sometimes they're looking for high blood pressure and sometimes they're looking for protein in the urine. There's a couple different factors they're looking for. So the reason I bring this up is because getting a diagnosis of preeclampsia is like diagnosing a moving target. And just because you didn't have preeclampsia at, your 8-month checkup doesn't mean that in the weeks leading up to your delivery or the weeks postpartum, it doesn't mean those symptoms will arise. And I think sometimes we forget once the baby's out, we forget those are still things we should be watching for. Would you correct or edit anything that I just shared, or maybe you can interject your thoughts from your wealth of experience?
Yeah, no, that's exactly right. It's not a diagnosis that we sometimes don't even understand why some people get preeclampsia and why people don't. So the idea is be very careful, or just really know what's going on with your body and be alert to these symptoms. And then they'll go and they'll do diagnostic tests to see if it is preeclampsia, or it may be one of preeclampsia's cousins, like HELP, right? So there's other things that are hidden, or
that's
maybe
a bad cousin.
That's a bad cousin.
We don't want that cousin. That's the cousin you don't want to come visit.
Yeah. And there's so many laboratory tests that have to be involved in addition to the high blood pressures, so that you can figure out if you have one of these things. And so you're right. It's not one test. It's not one symptom. It's a multitude of symptoms. But that doesn't mean you shouldn't look for help when you have one symptom, because that can be the beginning of where it starts to go downward, right?
Yeah.
So you want to be very aware.
Tell me a little bit about, like, this podcast. A lot of people who listen are going to be doulas and lactation consultants, a lot of parents. Tell us, like, how can birth workers like us and other perinatal professionals help spread awareness and ensure better outcomes for postpartum parents?
Oh, Naomi. I love doulas and lactation and healthcare workers. And I think that they are the community that's going to make and break or make a difference in somebody's life, and it's going to possibly save a life. I think some of the things that happen, and what some of the research that AWHONN did when they experienced or when they talked to women that received this education, is that when you're discharged or when you're being discharged, you're so overwhelmed. So many things are happening to you. You're so overwhelmed. You are so full of hormones that not everybody is ready to receive this type of education. And so it puts a lot of onus on the postpartum nurse, but it's actually a community. It's the healthcare workers, it's the doctors, it's prenatally the information you get, postnatally when somebody comes visit your in your home. It's reinforcement. And so they play a critical role when they come in, and they can simply just ask them, how are you feeling? Are you bleeding more than normal? Have you had any kind of vision changes? Do you have a headache that hasn't gone away? Are you feeling well? Have you had a temperature? Just investigating those signs so that you can guide your patients and say, I have this pamphlet, I have this magnet clean app. Maybe we should call your doctor. And then active listening to your patient. If a patient comes up to you and is like, I'm not feeling well, I haven't been feeling well, listen to them, investigate. be curious. Don't think that they're being dramatic. You know, something might be going wrong, and then you have a chance to save a life.
Yeah, exactly. That's why that episode is called, this is the episode that's going to save a life. Just because preeclampsia, well, these are lots of things that this checklist goes through. I mean, the thoughts of hurting yourself or someone else, the bleeding part, the temperature part, you know, which is pointing towards sepsis. I think this is a very, very comprehensive, overdue type of research. Exactly what you said, though, the postpartum nurse, when you're getting on discharge, I mean, there's a ton of information they're having to share. And as lactation consultants, you know, our visits are an hour and a half long. And I don't expect my patients to really remember a third of what I say. So that's why I have the partner there. You have a clipboard. The partner can take any like notes for like the imperative thing he doesn't want to forget. And then tomorrow morning, you're going to get an email from us with the like highlights of really, really important things. And then you're going to get some video links. And then we're going to follow up with you, because there's no way you're going to remember what I told you about infant feeding and your breast and all of that in one small visit, because you're sleep deprived and you're just trying to make sure you and your baby are okay. But then when you discharge from the hospital, prior to that, the information they're giving you is to help save your life or keep you well. And that short 15-minute discharge session is really challenging to kind of absorb all that and remember which parts were really imperative. And I think for sure, I don't know if it's just a Latin thing, but all my family, no matter, unless there's loss of life, like unless your limb is falling off, you're not going to the ER. Like, you know what I'm saying? Like, we're just not going to go, we're going to put some Vapo Rub on it and
Windex,
Windex, Vapo Rub, what are the random things we put on stuff? And so I think this is super, super important, because it's important for like the doula, if she's there, because in my lactation consultations, you know, I'm looking at people's feet, I'm asking them about their headache, I'm asking them about their temperature, and then our intake form is quite long and people get frustrated with it, but I'm like, these are really important things. And I promise you, I'm not just asking you this because I have nothing better to do, but I read all of this, and it is a huge part of the care that we give. It's a whole person type of care. And if you're telling me on your intake form that you're passing clots and your bleeding is not getting less, it should be getting darker and browner and like less and less. And if you're telling me it's getting heavier, brighter, and you're passing clots, hey, well, we have something to talk about. And it's been more than one occasion that I have caught a retained placenta, and a patient, I've told them what the warning signs to look for, and within 48 hours are like, yep, those things happened. I ended up in the ER, and guess what? They did a DNC, and now my milk is back. So, I mean, the pro to that is we get some milk. Once you get the placenta out of your body completely, you stop bleeding. We've reduced the risk of sepsis, but then your milk supply can then increase. More importantly, we prevented you from getting sepsis. But not everyone has a background of being an acute care nurse to ask all those questions. So having a handout like this is super important.
And that's why AWHONN decided to do a bunch of modalities. So you can get a simple magnet, you can get a cling, you can put the handout and put it on your refrigerator. And then the QR code that's on the handout actually allows you to download it as an app.
Yeah, I got that.
And you can put it in whatever language so that you can see it on your phone. Whatever it takes for you to remember, it talks about the warning signs, and then underneath it gives you kind of like verbatim, like what each of them can indicate, or why you might be having this kind of condition or symptom. Or
yeah,
sign.
The paper has this QR code. It says scan here to download this handout in multiple languages. And it even tells you, if you have these symptoms, tell 911 or your healthcare provider. And it has a statement. I gave birth on this date and I am having this specific sign. So it tells you exactly what to say. So I think this is brilliant and genius. And I really appreciate the work that you're doing. But you've always been a badass at whatever you do. So I appreciate you. You were so...
You too.
You were
and
really,
I can't take credit for this whole thing because this started in 2016. But we've gotten several grants to make it to enhance it, and based on patient feedback on our researchers, right now we're actually trialing it in emergency departments and in critical access hospitals, because some patients, like you said, don't have access to hospitals with OB care. And so it's really important that our EDs kind of know what to look for and then know how to transfer the patient to a higher level of care or somebody that can handle this type of situation. So we're trying to socialize it in the emergency department and next probably with EMS and inside the doctor's offices, because like I said, we're a community and the only way that we can protect our patients and our moms and pregnant people is if we, as a community, take care of them, right?
Because in Texas, we have a lot of deserts, like medical deserts. So that's
maternal desert. Mm-hmm. Yeah, we have a huge maternal desert population. And then as things get worse with funding and insurance, we have more and more hospitals closing and not offering maternal health care services. And so sometimes it takes patients almost an hour, even longer, to get to a facility that offers any kind of maternity services.
So this handout now is on the onus of the hospital or the doctor's office to go on the AWHONN website and download themselves, correct? Right now. And hopefully one day this will be a standard of care and people will incorporate this in their discharge teaching across the systems, if you will. But right now, if a doula wanted to use this when she did her visits, she would go to the AWHONN website, or I'll put the link in the show notes so people can just go and get it right then and there. And then I'm also going to put the links that you gave me for some videos. And tell me a little bit about those videos are.
Okay. So the first video is the patient video. And basically that talks about the post-birth warning signs. It's subtitled in 10 languages right now, in Spanish, French, in Arabic, and I'm working on a voiceover for those patients that can't read. So hopefully I'll get those voiceovers soon. And then the second video is actually a call to action toward our clinicians and towards our healthcare workers. It's basically saying that if you take a minute, you take a seat, you have a chat, you actively listen, you could possibly save a life. And so both of those videos are available on YouTube and on our website. They are open for public access. So if want to show people, you can. The patient video, you can use it in your discharge teaching. It's available also for individual clinical use, and you can print as many copies as you want of the post-birth warning signs in whatever languages and give them out. That's what they're there for. Okay. But yeah, it's a resource that I'm very proud of, and I think AWHONN's really proud of, and I think it's going to save a lot of lives.
Yeah, and it would be something also not to just think, oh, this is for the hospital, but midwives doing home births, that this is a tool used, that could be really helpful.
I'm glad you brought that up. So I'm currently in school again. And
really?
I know. Oh,
you're always in school. This girl is amazing. You're on another level. Okay. Tell me more.
So the goal for me is I'm actually going to trial this out in a midwifery clinic. And so I'm going to see how I can train the staff, maybe come up with a toolkit so that we can put this in clinicians' visits and doctors' offices, and then teach their staff to provide this at like 32 or 36 weeks, or even earlier, because as you know, patients that have had suffered a fetal loss can also have
I just had that.
Warning signs. You don't have to have a full-term pregnancy. You can have an early fetal loss. So the idea is teach them, and then they get it. Then they get it at discharge, and then they get it again with whatever service they go to. Yeah.
I can then put this in my prenatal class?
Absolutely.
I didn't even think about that. I also don't want to scare people too, but I mean, I can definitely put this in my, I definitely talk about this, because my whole class is like teaching people, it's insider secrets, like stuff that people don't really tell you about in a normal vanilla prenatal class. So I like to tell them all the things that gets missed. And this is a big one. I think that's very second nature, teaching, having this in the clinic. To me, that's just like, should be standard.
We never want to scare our patients. We don't want to scare, but we want them to be aware, because if they're not aware, what's going to happen? We need them to recognize these symptoms. We need them to react to these symptoms, because if they don't know, then they can't get help. And then we'll keep seeing maternal morbidity and mortality skyrocket. So we have to provide that education.
Well, what else is interesting? A lot of parents will take a infant CPR class while they're still pregnant, because they want to make sure they know how to keep their baby alive. Ain't nobody trying to ask how they can keep the mom alive. Yeah.
This is
important.
That's actually what we saw in some of our research, that same research where we interviewed women who had this. One of the themes that came out was the invisible pain of postpartum. Once they delivered, they felt overwhelmed. They felt alone. There was this thing that was called baby trumps mom. So no longer are they viewed. It's always about the baby and they're forgotten. And we can't forget them. Without them, we don't have our family unit. Without them, we hurt the community. So we have to put them in the forefront, because with our, patients being taken care of, then they can take care of their families and so on.
Yeah. So important. So important. I love this. I love you. I appreciate you for taking the time in your busy day with all your traveling. And thank you for you and your team of putting this together, doing the research. I know it's not easy to get that grant money, do those grant applications, do all the studies, get things approved, get it out here in all the languages. Like, you're doing great work. We don't have all the time in the world to get into more details as to maybe some other systemic reasons for why we have such high maternal mortality. But I do love us being able to talk about some solutions or some tools that we can use to help improve them. And so these post-birth warning signs, I'm going to just go over the acronym real quick. Post is pain in chest. O stands for obstructed breathing or shortness of breath. S is for seizures. T is for thoughts of hurting yourself or someone else. Then we get into the birth acronym: bleeding, soaking through 1 pad an hour, or clots the size of an egg or bigger. I for incision that's not healing. R for red or swollen leg that is painful or warm to touch. T for temperature that's 100.4 of Fahrenheit or higher, or a lower temperature of 96.8 or lower Fahrenheit. Or an H stands for headache that does not get better even after taking medicine, or a bad headache with vision changes, or even if you have vision changes by itself. Did I miss anything?
No, you got it.
I'm cheating because I have the paper in front of me.
That's great.
All right, my friend, thank you so much. I hope that share this episode with as many people as you guys can. Grandmas, aunties, doulas, anyone who's going to be in there just kind of watching and peeking in on mom over the first few months. This is really up to a year postpartum. It's really important for everyone to know these signs to help improve our maternal mortality outcomes. We want them to be lower.
Yeah. Thank you, Naomi, for having me. I'm so proud of all the work that you're doing.
I appreciate you. I'm trying to be like you. Thank you so much.
Bye.
Thanks for listening. To learn more about newborn feeding and get your free swipe file, visit milkdiva.com/newborn feeding. And if you've ever said, wow, I wish I would have known that while you're listening to this podcast, then help a friend out and share this podcast with them. You can also help us by leaving us a rating so more people can benefit from finding this podcast. Medical disclaimer. Please know that all opinions expressed on this podcast are solely my own and not intended to substitute the advice of a medical provider. I am not a medical doctor, and all information shared is intended for your general knowledge and is geared towards full-term, healthy singleton infants and healthy, low-risk pregnant or postpartum women.